Are you a practitioner in nutrition medicine, nutritional therapy, functional medicine, anything to do with any of those above? And if you're a practitioner in alternative medicine, be it an acupuncturist, a reflexologist, yoga teacher, this video is for you. But I'm going to use it from a nutrition perspective so you can understand how you can also integrate it into your practice, okay? But before I do, I am selling something. I am selling a book which is called Rapid Relief Homeopathy. And this book has been put together by a whole group of us, qualified homeopaths and those who use homeopathy in their homes and their lives. And this book has been put together with the vision in mind, is that all the money raised from selling this book is going to go towards the New School of Nutritional Medicine's student clinic. Why? Because my passion is that I want to be able to somehow pay towards the functional tests that we use in our student clinic with certain clients, because clients are coming in with conditions that I had never seen when I first trained 25 years ago. The conditions that we are seeing now in clinic, I really wish we didn't. But we are seeing autoimmune conditions, we are seeing severe eczema, we are seeing celiac disease in children at the age of 5. This is not what health is about. So this book has been put together primarily because I want it in the homes of people who can use it and avoid medications as much as possible. Medications have their place, they have their role. I had tuberculosis as a toddler, had antibiotics, and I lived through to tell the tale today. If it wasn't for antibiotics, I may not be here talking to you about what I'm talking about now. So thank you if you're going to invest in the book, because that money is going to go towards a clinic which trains students in nutritional therapy and integrative psychological coaching, but also it's going to be helping people who would not be able to afford to see a nutritional therapist who's also an integrative psychological coach. Okay, so thank you for that. So let's go back and let's explain how I use it and how I train the students to use it in the New School of Nutritional Medicine. If you're a practitioner, you will know that most people come to see us when they've already got a condition, unfortunately. I wish people would come to see me and say, right, I'm just coming in for an MOT, I feel great, I feel fine, lots of energy, I just want to stay like this for the next year, then I'll come back next year. I wish. But normally we get people who have tried everything else and then they come and see us. So they come with a disease, and one disease I've labelled here is Hashimoto's, a very common autoimmune condition. Unfortunately, and it's usually mainly women, a lot of women who have an underactive thyroid actually don't know it's Hashimoto's. They're told here's thyroxine and off you go home. And as practitioners, we know better that we want to make sure, do they have antibodies? Is there an autoimmune picture to this condition, or is it actually hypothyroid without the antibodies and it's not autoimmune? So what do? We can do blood tests. You know that, I know that. Once we've done the blood test, we might do some functional tests. We might also suddenly discover that they've got low cortisone, low cortisol metabolites as well, and we might support their adrenals. As they get the nutrients that they need, as they get the food, the supplements, the personalized program, they start feeling better. As they start feeling better, they might have a flare-up. They might get a urinary tract infection. They might get a chest infection. They might get an ear infection or tonsillitis. They might get an acute symptom, an ailment that they've had before in the past. Why? Because they are tracing their timeline. That means they are working back to health. So here's health. This is what we want. We want to be here. As we travel life, we do acutes. And as these acutes come up, urinary tract infections, ear infections, chest infections, what else do we do? Oh, hay fever, antihistamines, antibiotics for sinusitis, and then period pain, painkillers, and then maybe birth control pill for acne. And so all this suppression goes on and on and on. And then we get to a point where we are diagnosed with a chronic condition. Then we are unraveling the client as we work with their chronic condition. As they unravel, which is healthy, it's not unhealthy, although some clients can think, well, you've made me worse. We haven't made them worse. Their body's saying, I now have the vitality, I now have the capacity, I now have the nutrients, I now have the safety to deal with this gunk which now is coming out as a urinary tract infection. What do they do with that gunk? They normally go and get antibiotics and they suppress it back again. What we do at the New School of Nutritional Medicine is we train our students to use rapid relief homeopathy. So when they do that acute, they use homeopathy, they do not suppress it again. So what they're doing, they're then going back on their journey to health. The saying is, we've got to go back to go forward to health, okay? Now, it could be a flare-up, which again, you can use rapid relief homeopathy for. It could be any acute symptom. And what this book does, it shows you how to use rapid relief homeopathy step by step. We've even got videos, QR codes, if you're an audio visual learner. What we're also doing is we're going to run an online course, because there will be some of you who will want to dive deeper in how to use what we call SAR codes and no-sodes. We have some no-sodes in the book as well. And we've had students who have used no-sodes. For example, medarinum is a no-sode which some of the students have used for reoccurring urinary tract infections, which has worked wonderfully. Another student used it for reoccurring thrush infections for a client, and it worked wonderfully. Thrush never came back, because as the body is healing, it has the opportunity now to clear out these suppressed illnesses, in inverted commas. Imagine, say for example, I have a teenager, one is no longer a teenager, and if I ask him, right, it's your turn to do the cleaning, he might decide to do the cleaning and shove some of the dirt underneath the rug. Not that I'm saying he does that, okay, but he might decide that he's not going to sweep in the corners, just put, do the minimum he can, and job is done. When it comes time for me to then do the cleaning, I'm pulling up the rugs, going underneath, going in the corners and cleaning it all out. So that's what we're doing when we see our clients. We are now going in and we're cleaning their whole systems, all their biological systems that are connected together. But in order to do that, they have to have the capacity, they have to have the nutrients, they have to have the environment. But when they do that, we've got rapid relief homeopathy to address it. Okay, so that's one way of using rapid relief homeopathy. Now, if you're listening to this and you are a practitioner, the other thing that I use at the school that we train our students to use rapid relief, it's not so rapid relief homeopathy, but it still comes under that umbrella, are SAR codes. Now, SAR codes, for example, you might have a client who's done a test, they've done their full thyroid profile blood test, and they found out that their reverse T3 is high. Okay, so when reverse T3 is high, we ask the question, why is that? Are they stressed? Their body's trying to slow them down. What's going on? And we might find that and then we might decide from that, as we say, we find that their cortisol levels are low and their metabolites of cortisol are low. So overall, their HPA axis is quite flat, or it's plodding along. It's just dealing with life. Okay. Now, for that, we would, as nutritional therapists, recommend an adrenal glandular, potentially. Now, what we've also got to bear in mind that some clients do not do well on glandulars. Give them an adrenal glandular and they think they've had 4 cups of coffee. Yes, absolutely. There are some clients, when we give them an adrenal glandular, they do brilliantly. They feel like they've been plugged into the plug socket and they've just been recharged. Fantastic. But those who can't, in homeopathy, the way we train our students, we teach them to use SAR codes. So you can use adrenal cortex in homeopathic form, and they can use that whilst we work on all the underlying imbalances, and it's gentle and it's regulating the adrenal system. So we also can we use even thyroidinum when thyroidinum is needed, which is actually supporting the thyroid gland. And again, this is short term whilst we're still working on the underlying causes. But the results are fantastic, because what we're doing is, although underpinning it all, we're using the nutrition, the lifestyle, the functional medicine tests and what have you, and readdressing all those vital areas. When something pops up either as an acute ailment or something that needs a bit of support, it needs hand holding, like the adrenal glands might need their hands held, say, okay, I'll show you how to work, I'll show you what to do. And once they've kind of picked up and they've got the support, they won't need it after a while. And then next thing you know, you redo their test and their reverse T3 has come back down, their hypothyroid symptoms have kind of cleared up, they start losing weight, their hair stops falling out, their dry skin clears up. It's wonderful. But in order for it to be wonderful, you need to know how to use it. So the book is there to help you to understand how to use rapid relief homeopathy in your practice. Now, if you want to then also learn how to use SAR codes, and even if you want to go deeper and learn to use how to use nosodes when there's repeating patterns, and we see those again and again, and sometimes we always say it can be those predispositions, as we can see in the genetic SNPs. So somebody who has methylation issues, they can keep getting issues with whether it's mental health issues or it's hay fever or it's psoriasis, skin conditions. Then we can also use these nosodes alongside already what we're doing as practitioners. Okay, I hope it's been a bit of a long video, but I hope it's been helpful. And if you invest in this book, remember you are also supporting the school student clinic at the New School of Nutritional Medicine. You're helping somebody on their health journey.